I'm the lead nurse for Garrett County Schools, and I'm also, there's a couple of my nurses in the back, I'm also a high school school nurse. Asthma, have any of you ever been to Garrett County? Seen our beautiful 64 miles of shoreline, our ski slopes, you know, you can go zip lining. It sounds like paradise, doesn't it? All that glitters is not gold, believe me. If you've only been down 219 past all the wonderful things, then you've missed some of the real disparity in Western Maryland. We had a grant. We worked very closely with the health department, and we had an asthma coalition that was going full force. And back in 2004 and 2005, worked with the health department, the board of ed, the hospital, some local healthcare providers, and some community members. So we kind of got together and we were figuring out what we needed to do for our community. And at the table, we had respiratory therapists, educators, pharmacists, nurses, program managers, administrators from all the different agencies, public health professionals, physicians, community leaders, parents, school nurses, and a little bit of grant money. And some of the catalysts is some of these people in these positions actually even had asthma themselves or had children with asthma, which made them very vested in working with the Asthma Coalition. So what we did with this little bit of grant money and a lot of time and enthusiasm is we had mini asthma camps. On Saturdays at the health department, we provide food and we would have education for the parents and education for the students, and we would make it fun and exciting, because what kid wants to give up a Saturday if it's not fun and exciting? PTO speakers, we actually went out to the PTO meetings and had our asthma educators from the county and some of these people who saw our talent at the table out there, and our pharmacists talking about the controller medications, answering questions, educating parents, and made it part of PTO meetings, and we're able to have some refreshments or something there. And we even had in 2 schools, one at either end of our county, a meeting in itself that was just parents that could come for asthma information. And we provided child care. We did everything but pick them up in a bus and bring them in. We have a community health fair still to this day that goes on, and it's getting bigger, and it's everything. It's not just asthma, it's orthopedics. If you want a hip replacement, you can go by a booth and see how they do your hip replacement. So it's growing, and asthma definitely still has a part of that. But it was a lot of the catalysts that started our health fair in the county. We did a certified asthma educator program. So we had a couple school nurses went down to the program. We had a couple people certified in the county, and that brought back some people that we could do some in-house education with our staffs. What else? We had the little bit of grant money. We were able to buy supplies for the school nurses, nebulizers for each of the schools. We stocked our libraries, our high school and middle school libraries, with books on asthma. So if they did research, or anything that we could get that was computer-based, if they did a research project, that they would have something there. Also lists of websites for the librarians for kids that could go to it. For the elementary schools, we had like the ABC of asthma, and the little asthma guy with the lion, and the school nurses actually went into classrooms and read. And so that we could make asthma among the students something that if a child had asthma, they weren't being ostracized, that the other kids would understand what was going on, and made it part of the language so it wasn't a taboo. I'm also a teacher, and I know what a teacher wants in a classroom. They don't want to deal with it. They don't want to take the medicine. They want it packed up on a field trip. They don't want to have to think about it. That's what the school nurse is for. So I can see it from both ends. They're scared they're going to make a mistake, but they don't realize by being vested in that in their classroom and everyone understanding, being on the same page, what they can accomplish, that loss of instructional time adds up if you really keep track of it. Educational in-service for our school nurses. We like to say we needed to educate ourselves to be better educators and to spread the message and to get kids that needed better treatment than they were getting. We need to be educated ourselves. Kindergarten registration is a big thing in Garrett County. When you come in to register for kindergarten or pre-K, we actually have tables such as this, and you would go meet the principal, your teacher, you meet the nurse, and the health department's right beside of us. We look at your immunization. The dental people were there. They do a dental exam. You can get your immunizations. We used to do vision and hearing, but it's too hard at kindergarten registration. And asthma, our asthma educator would be there. So we right there at kindergarten registration could give out all the things. And of course, they have their physical. And we had sort of a trapped audience where we could talk to them. We added asthma to that. And then we would go to grand rounds. We figured out that we need to really work with the physicians. And I'd like to take you two back to Garrett County because I think that we need more physicians and more people like that to work with us. And so we went to grand rounds with our health officer and took the asthma action plan. This was before, even for asthma-friendly schools when it first came out, and showed it to them and explained, and we fed them well. And all the docs that were there at the hospital, this was just a few of the doctors we work with because we are on the Pennsylvania-West Virginia border, so our people get care from multiple sources, and showed them what the asthma action plan was and with the asthma coalition, what our thrust was and how they could come and help us. And so we started our education, school-wide education program. So, well, the first time we were doing all these things. Now, we didn't do all that in 1 year, but it's what we were doing. And then this lady, and Rachel Hessen came, and you just don't say no to either one of them, and explained about the asthma-friendly schools. Now, the thing of it is when you find out that you have a problem, you have to do something about it. So sometimes when you go to start to become an asthma-friendly school, administration may not be really on your side because if you have to do something about it. So we kind of went through, not on purpose, but went through the back door. She brought us the information, and we worked with the health department. It wasn't a month later, there she was on the phone, and we were sitting down to look at what kinds of challenges we faced and what we could do, and looking at an assessment. We found out we had an educational deficit, which means we all needed to learn more about asthma. Parents, the physicians, the nurses, we need to be on the same page. We needed to work together. We already thought we did that, so we were surprised. And the lack of health department chronic disease specialists, and I'd like to say they have one, but they still don't have one. So we're still working. And then this is our asthma educator from the hospital, respiratory therapy, sitting down with some of our nurses, and actually came in on our days, school time, and did education with us. And gave us lots of goodies, lots of spacers, lots of peak flow meters, and anything that they could buy out of the grant that we could actually put to use. And then guess what? When we looked at everything, we found out that all 15 of our schools won a bronze award for what we were already doing. Pretty good, but still not gold. And this is our superintendent of schools and our board members at one of the board meetings when they were presenting some of the plaques. And of course, they like plaques and they like pictures, so they thought we had done a really good job. But if you do a good job, it means you still have to keep doing a good job and do even better. So what we wanted to know then, we knew we had a knowledge deficit. We had kids that from kindergarten to 12th grade had checked they had asthma, who maybe at one time had an inhaler. Did they really have asthma? They keep checking it. No inhaler ever showed up, never had a problem. So we actually needed to take a look at how many kids we had. 285 students reported in our county. Now, when you only have 10 school nurses and you have a small population, we're a good pilot for anything because we're small enough that it's manageable. We found out we had 123 had controller medication and none had an asthma action plan. And that means other than the asthma action plan or any kind of comprehensive plan that docs had sent in. Only the emergency plans that we had written. Okay, so what we're going to do about that. So we got to have a patient questionnaire that we sent home, an inventory to parents to fill out that said things like, you know, how often do they use, what kind of medication are they on? How often do they use the rescue inhaler? Do they often wake up coughing at night? I sent in a copy, it may be on your desk, your thumb drive. So we sent this home. We also sent an asthma action plan, and we sent a letter from the school nurses. Well, the ones that we got back, we got maybe 2 or 3 real asthma action plans. We got a lot of nasty phone calls from physicians. When we, you know, why are you sending this out? This parent brought it to me. I'm not filling this thing out. I don't have time. A few sent their own, you know, the few specialists did send something that they had made up. And when we didn't get back, we called the parents. And when we called and talked to the parents, then we got things back and we started the conversation. We had an awful lot of kids some that do have asthma, need that rescue inhaler, that would just say, call me if you need it. Well, later on when I show you just how big Garrett County is, you'll realize 35 minutes later, in a volunteer rescue squad, you need to have it at school. And then we called the parents that didn't return the form, and we really tried to promote the asthma action plans. Okay, we tried some statistics. So we got Yock Glades Elementary School. We thought we really need to get a handle on this, and we need to look at it. And we need to look at it as dropout prevention. We need to look at it, are these students getting excluded from anything? Are they being ostracized because of asthma? So we started taking a look, and we weren't too successful at statistics. H1N1 came along. We had no real way to gather that data. Are they deer hunting, or are they having an asthma attack? And then when H1N1 comes along and things like that, you don't have time to call every student. So this is what she tried to get together for us. Notice there are, our plans went up, but the actual asthma action plan, they don't realize how important the green part is. It's just, here's the inhaler, if you have a problem, go for it. So we decided we need to do something else. So for this year, what we've done, we have had an initiative with our bus drivers. We, unlike some of the other counties, you can come in if you ride a regular bus. We have that plan on file. If your child has diabetes, any kind of chronic health problem, they have an EpiPen, they have an inhaler. So the bus driver has that information. Because some of those routes, you don't have a cell phone, won't work. If you want to go home with another student, you just bring in a parent letter from both students and you can ride a different bus home. So we came up with a system where that bus pass is coded so that bus driver could quickly look down and say, oh, asthma, kid has an inhaler, or this kid's diabetic, and know immediately what kind of medical problem they were dealing with. We did that. Green schools, we got all green. School initiative was changing all of those chemicals and the soaps and things that we used, and we actually wrote in our asthma action plan, our asthma friendly schools, into our green school plan. We got Power School, which I think is going to make all the difference. If you're not familiar with Power School, it is a record system that we changed to that has our health records are now electronic. It's real time. The parents can go in and look at the grades, and we can go in and put in our little medical thing, and you click on it, and it actually has the plan for the teacher. The student has asthma and what to do if they carry an inhaler. The parents can see what we have on there, and we can extrapolate all kinds of data from this. So that all these kids with chronic diseases, we can look at absenteeism and compare that eventually to the dropout rate. Our health forms, we've taken our health forms one step further. Every time the kid goes on a field trip, there's no longer just the blanket form, they have to fill it out. And they have to fill out the comprehensive medical form that's on the back, and it talks about asthma. So, because we were getting, the first of the year, little Johnny has asthma, forms middle of the year, all of a sudden he has no asthma, he's on this field trip and mom's tired of putting it, we don't even have a telephone number to get a hold of mom. So they have to have it filled out so that we can keep him current. And we're working with guidance in elementary. Came up with our own book. We found other sources now that we don't have so much asthma money. This is actually part of our master plan in the county, which is for the board to actually put this in part of their master plan, put asthma in was a big thing. And this is Garrett Gorilla, who has asthma, and his best friend, he moved from somewhere else, Doug Deere. There's a lot of deers in Garrett County, who used to bully him. So we're going in this year with each of the guidance counselors, with that nurse, and we're sending home things on triggers and asthma, and talking to the students about asthma, and they each get a coloring book, or an activity book, as we call it. Okay, finding the disparity. This is Garrett County. Just look, and we're to the west is West Virginia, Pennsylvania above, Allegheny County, and those statistics this morning on Allegheny County made me kind of cringe. But look at all of our schools. We did close one of our schools, so we're one school down. We have 10 elementary schools. One is an elementary middle school, and it's also an Amish school. 2 middle schools, 2 high schools. Our total enrollment, look at our free and reduced lunch, 46.8. Look at the income, under 25,000. 25,000 to 49. Unfortunately, we only have Caucasians with asthma, so that couldn't be a disparity for us. But the problem is, if you have insurance in Garrett County, and you can go to Ruby at WVU, or you can go to Pittsburgh, or even anywhere you want, or in Allegheny, if you don't, if you're on Medicaid, you can't maybe go 45 minutes for care. You may have, if you need to see a specialist, you may have to come to Baltimore. So someone that can't afford the gas to pick their student up from school when they're sick certainly is not going to drive 3 hours. They're just not going to go. Those with insurance, and if you make over this and have good insurance, you can drive 40 minutes to see a specialist.